Welcome. Thank you for joining me. This is the seventh and final webinar as part of the Counseling Center Summer Webinar Series. I hope that you've enjoyed and benefited from our programming thus far. My name is Dr. Richard Martinez. I'm a psychologist at Texas State University's Counseling Center, and I also oversee our center's educational programming and outreach. Today's webinar will primarily be focused on ways that we can support our students from a mental health perspective as they adjust back to classes during the current COVID-19 pandemic. I will not be touching on areas related to disciplinary issues or enforcement measures, and would encourage you to reference the Roadmap to Return plan and direct any of those questions to your department chair, director, or student conduct and community standards office through the Dean of Students. I will also highlight information about digital mental health resources that could be helpful for your work, particularly for students who will be completing their coursework online and away from the San Marcos or Round Rock locations, as this may be a new situation for you to be in when those students are needing assistance or help. Please keep in mind that these resources that I'm going to be talking about may even be helpful and effective for you to utilize for your own mental health and wellness as faculty and staff who are also experiencing the consequences and the impacts of the pandemic along with our students. There'll be a few interactive questions utilizing the chat function in Zoom, so we can share some of our experiences interacting with our students thus far and learn from one another. I'll also reserve time at the end of this webinar for a few questions. So when we get to that point, please use the question and answer, the Q&A function in Zoom to submit those questions and reserve the chat for my question prompts. If we submit questions in the chat function, they can get buried and then it's hard to go back and see those. All right, and without further ado, we'll go ahead and get started. So I'll be covering quite a bit in our time together today, and since roadmaps are in fashion right now, I created a roadmap for this webinar. So I'll begin by discussing some of the stressors our college students are experiencing due to the current pandemic, both from anecdotal evidence and also from new surveys that are more formal that have been coming out since March. I'll then discuss our shared responsibility as faculty and staff to support the mental health and well-being of students in various ways we can accomplish that goal. I'll also discuss some online mental health resources that'll be accessible for students who are completing their coursework on campus, as well as through distance learning. And there will be an overview of the Counseling Center, its resources, and as I previously mentioned, time at the end for questions and answers. Okay. So I thought this was important to share some of the personal anecdotes that have come up as students have adjusted to COVID-19 beginning back in March. So I was looking back at my own experiences since March, and I thought it would be important for us to just kind of share some of these stories and give voices to them as students have attempted to balance these new stressors with their primary role as students. So these new stressors have an ability to impact student mental health and well-being and how they function on campus and within their classes. I think discussing these as a group will provide more context and understanding of our students' experiences and awareness building of their potential struggles. In addition to hearing these personal anecdotes in my own therapy sessions with students, I've also had the privilege of participating in the WellCheck calling program, and also as a reviewer for the Bobcat Care Scholarship Review. And I heard quite a few stories through those avenues of review as well, and those points of contact with students. So I was able to encapsulate all of those experiences into something I wanted to share with y'all. So just some examples that we can go through of things that I've heard from our students. There's like numerous occupational stressors happening right now. So working with many students who have either lost their jobs and their sole source of financial assistance, or their hours have been cut, or they're in essential positions that require them to be interacting with customers either in the service industry in restaurants or at different shops at the outlets for example. So that has been a tremendous struggle that I've heard. And one thing that I've also had brought to my attention is that students don't oftentimes feel like they have a choice to say no. So if they're scheduled for a shift and that interferes with their class time or interferes with like their appointments that they have, they felt pressure to keep those shifts, because if they were to say no, they would be one of the folks who would lose their position, or the managers would pick folks who have more flexibility in their schedule right now. So kind of felt like they didn't have much power in their jobs and their shifts. I've also been hearing a lot of financial stressors. Housing has been a huge concern. So we have students who are paying for their leases right now in San Marcos and not living there. And, as I mentioned, losing their jobs or having reduced income, but having that stable rent that they have to pay each month. And that's led to food insecurity as well. So hearing stories of students who have to skip meals or space out how much, like kind of portion out their food, because not just them, it's not just them struggling, but their families as well. And so trying to be able to connect them with resources around that food insecurity has been vital, as we know that impacts so much of their ability to concentrate and be present and to manage their mood in classes and on campus. There's been a tremendous amount of family stressors too. So many of our students who have been pretty independent have found themselves having to move back in with family, and family who is also very stressed because of the all of the pandemic factors taking a toll on each individual member of the family separately, coming together. That can sometimes cause chaos and stress with all of those adjustments. It's particularly, I've had students who the whole family is living from home and not working, and spending that much time together in close quarters has created some conflict. There's been quite a few technology stressors as well. I can kind of speak to that as well from like a professional aspect, adjusting to using Zoom, having access to laptops, stable internet, working with students who are in more rural communities who don't have access to broadband and have been relying on their phone to be able to do some of the web-based tasks. So that's definitely impacted their ability to do therapy sessions, and also their ability to watch lectures and be able to do their homework. There's been interpersonal isolation, as we're all well aware and probably have been experiencing ourselves. So there's been a lot of grief and loss around not being able to, go hang out with friends or have that summer experience that so many students were looking forward to. Additionally, there's been fear of exposure and fear of the virus and infecting others, as well as testing access. So I have a lot of students who have family members who are considered high risk or vulnerable populations. And so fear of coming to campus or fear of going to work and bringing that back to the family, and quite about a large amount of guilt around potentially bringing that virus back into the home. And not having speedy access to testing within the community. So for example, here in the Austin area, some folks are taking up to 11 days, is what I was hearing, to get their tests back. There's also academic and campus uncertainty. As we know, we have our roadmap to success, and that's been changing in response to available evidence over the course of the summer. So it's been hard for students to do any long-term planning when it comes to housing, when it comes to jobs, when it comes to their class schedule, without knowing, hey, is this going to actually be in person? Is this going to be online? And not having that certainty has created an additional stressor. I've also heard a lot of frustration with peer compliance, which I thought was kind of surprising. So students who are angry and frustrated with folks in their social circles and individuals within the community who are still going to parties, who are still, acting as if nothing's happening right now. And I think fear around having to sit in a room or even in shared community spaces with those who aren't taking the virus or the precautions as seriously. I think it's really important to highlight another portion of the story that I've been hearing, which is the disproportionate impact that this pandemic has had on, in particular, our low SES students in our communities of color. So knowing that the pandemic has been hitting communities of color harder. And so there's more individuals getting sick, there's less access to resources in those communities, and our students with from low social economic status and backgrounds are gonna have less access to, high-speed technology or really, modern computing and things like that that are necessary to be able to do our online or even those hybrid classes. And in addition, another population that's been impacted as well has been our LGBTQ IA plus students. So many of our students come to college and that's their safe space to be able to come out and to explore aspects of their gender and sexuality, and then having to move back to family environments that aren't accepting, or to more conservative parts of the state where they've felt like they can't be out or be who they truly are, and having to go back into the closet. That can have a huge impact on one's psychological health and well-being, but also their ability to perform well and concentrate and function in their classes. There's been a huge loss of routine and structure. So students who, I get up at 8, I do this, and this, and I have my day planned out till 5. It feels like that's been thrown through a loop for many of our students who are just kind of stuck inside their apartment or inside their room for much of the day, and they don't have that structure and that predictability to rely on. That was kind of a grounding force and really helpful for managing stress and anxiety. In addition, there's been a change in access to coping tools. So many of our students rely on getting out of the house, on going for walks, going to hang out with friends, being able to go to churches or places of worship, different community organizations or campus orgs, and not having those in person and in place in the same way that they were before has really taken a blow on ways people have coped with their stress before, and caused them to have to come up with some new strategies kind of on the fly to manage that. And folks have been able to adjust at different speeds and at different capacities to those changes. And finally, just a mourning or loss of the college experience. So in particular, I think this has hit our seniors quite a bit, who were looking forward to, their accomplishing things from their bucket list their last year here at school, and how it's impacting that portion of their experience, but also their networking and their job searching and the mentoring that they rely on in their senior year to help launch them into the next phase of life. I've heard a lot of frustration and difficulties and sadness around that. So I'm wondering if we could take a few minutes, if y'all could use the chat function here in Zoom to share some of the experiences that you've had working with students since March, and some of the struggles you've heard from them. And I can read those out loud to us as a group, because I'm sure there's probably some that I missed on this list. Yeah. Okay, so I'm starting to get things coming in. A lot of uncertainty about signing leases and whether it'll be worth moving back to town. Professors not responding to questions. Different time zones causing, missed exams or even inconvenient scheduling with those. Let's see, music students who are very concerned about not being able to perform with their peers and the impact on their education. Yeah, there's a lot of applied classes and skills that I don't think necessarily translate as well to the online method of teaching, at least at this point. And so trying to get creative to make sure they're still getting that same experience or that same skill. It's definitely been, I think, frustrating for students to be able to get that quality of education. I'm hearing frustration about how changes are being communicated by both the school and the general media, with communication lacking. Students who did not return to class and couldn't be contacted, so just kind of falling off the grid, not knowing how they're doing and being concerned about their welfare and, where they're at right now. Hearing a lot of affirmation about just hearing a lot of the same things that are on this list. Okay. Actual fear of getting the COVID test and associated discomfort of the actual test. I've heard that, and I've also heard what are the potential ramifications of getting tested and, having symptoms, like how will that information be protected when they report that to the university or to an employer, and would that impact their ability to attend classes and to work? I think sometimes students are put in this difficult situation where they feel like it's more advantageous not to say anything because the risk, it doesn't impact their school or their work as much if they aren't reporting their positive results, or if they just don't get tested. Students who are embarrassed or feeling scared or panicked in classes. Difficulty acquiring internships with COVID. Yeah, I've heard that one definitely as well. Graduation ceremony not happening in the traditional sense. Not getting to come to campus for new student orientation. Technology issues. Oh yeah, I can't believe I forgot to put this one on here. Staying organized and missing coursework. So time management, organization skills, those have all been like very tested for students right now. And like I said, some students have been able to adapt really quickly and build those new skills, while others have really struggled and continued to struggle to adjust. So thank you so much for sharing some of your experiences and allowing me to talk about those with us as a group. I'm going to go ahead and move on now. Okay, give us a second. Okay, so right now I think it's important for us to look at some of the preliminary data from surveys that are starting to come out. I know that this is something that's going to continue to be assessed, particularly as we move into the fall, but from like a science perspective, I think it's really important to go beyond the anecdotal evidence and just see what are we seeing at the national level from college students, because I feel like so much of this is going to predict our experiences and how students are going to be presenting this fall. So one survey that I found that looked at the latter part of the spring semester, I thought brought some important insights here. So please keep in mind that the survey that I'm going through, the data was collected from March to May 2020. And since then, the pandemic has increased in severity in different portions of the US, particularly here in Texas, since that data was collected. So this survey was done by the Healthy Minds Network and the American College Health Association, which they administer the National College Health Assessment. And they administered these new items related to COVID-19 stress and how students are adjusting to the pandemic. So the items focused on students' attitudes, their concerns, preventative behaviors, and perceived supportiveness of colleges and universities related to COVID-19. These items, they were fielded to random samples of college students on participating campuses here in the US. And overall, they had a response of 18,764 students from 14 different campuses. So the universities that participated were predominantly large public institutions, and they were from geographically diverse segments of the US. So they had, samples from all the way from the East Coast to the West Coast here. So as we look at these results, I do want you to take these with a grain of salt, as there's some unique factors related to Texas State and our campus here, in particular being a Hispanic serving institution with a large first-gen population. There's going to be segments of our campus population that are impacted differently and more severely than those who are represented in this survey. It's going to take a while for more nuanced data to be collected and published on COVID-19 and its impact on our college students. Okay, so the first one here looks at financial stress. So financial stress is a known predictor of student mental health, and it was shown to be significantly affected by the pandemic. So 2/3 of the students who responded to this survey reported that their financial situation became more stressful. In addition, 1/3 of students reported that their living situation changed. So, they had to move out of the dorms or move back in with family and whatnot. And I continue to hear over and over again concerns from students in this area. So it's pretty in line with that anecdotal evidence. Furthermore, 60% of students perceive themselves to be susceptible to COVID-19. And students express concern about their personal safety and their security, but surprisingly, they express even more concern about the safety and the well-being of others around them and fear of spreading that virus. So again, as I mentioned too, with that anecdotal data, our students may have parents who are elderly or have pre-existing conditions. And there's a lot of fear about bringing that back, the virus back into their communities and into their homes. I'm wondering from like a public health perspective, if there's a way to capitalize on, having students embrace some of these safety measures that we've put in place and kind of taking it from a framework of like, let's not bring that back to our communities. Let's not bring that back to our homes. And this is why it's so important for us to wear masks, to wash our hands and whatnot. Students also expressed a high level of concern and stress and anxiety about how long this pandemic will last. And I think that definitely is something that sits with me in my experience too, especially as we're all sitting waiting for a vaccine to be developed and one that will actually be widely available and distributed to folks and trickle down to us at the campus level. So I think we're all kind of waiting for that as well. So this next part kind of talked about compliance with public health recommendations. So the majority of students reported following public health guidelines for hand washing, so about 60%, and 70% for social distancing or physical distancing. However, because the the data was collected starting back in March, they hadn't added a question about mask compliance, because at that point in time, I don't think that we were at a place where we were saying as a society, that's one of the most important things you can do. So just kind of keep that in mind that I don't think that was a wide recommendation back at the point of the survey's development. And also this last part is super important. 6% of students reported personally experiencing race-based discrimination as a result of the pandemic, while 41% reported witnessing that discrimination towards another person, either online or in person. So this is an important point that we need to sit with and acknowledge the xenophobia that's been associated with this pandemic and the potential impact that these discriminatory experiences can have on our students, particularly those of Asian descent and our international students. And, I think this continues to evolve and change as we hear certain populations being scapegoated for the pandemic continuing. Okay, and one last page here with some results. I'm going to take a drink just a second. So we'll focus a little bit more on the mental health part with this part. So the majority of respondents, about 60%, reported that they did not try to access mental health care during the pandemic or related to its impact. But of the approximately 42% who did, they shared that COVID-19 actually made it harder for them to access the care that they needed. So if we're thinking about it, counseling centers across university campuses are pretty flooded to begin with, but when we add a big campus-wide event, that can create quite a bit of demand over and above that. And when students have to move back to homes out of state or out of the country, it can make it difficult for them to connect with ongoing care due to some of those limits to practice outside of out of the state for practitioners. So we in the Counseling Center have had to get creative in helping people find resources in their home state and in their home countries. There's been symptoms of mental health conditions have overall remained high in college student populations, both before and after the COVID pandemic, but we did see some changes. So relative to the fall 2019 semester, the prevalence of depression increased, and also substance use actually decreased in the spring 2020 semester. And I have kind of a hypothesis there. I think part of it is folks were initially having less access to some bars, having less access to some of those big parties and community gathering spaces where some of those substance use behaviors were occurring, and that could have had an impact on that. But I have a feeling that that was just kind of a temporary decrease, and we're going to see substance use return to pre-COVID levels. And actually, if it's mirroring what's happening in the general population, it's probably going to be increasing this fall. So in March through May of 2020, a high proportion of students reported that their mental health, for example, depression and anxiety, negatively impacted their academic performance. And it's interesting to note that while these students are saying that their mental health was impacted and deteriorated, one of the things that we actually saw that increased was their level of resilience. And so if we think about that, I really think what relates to that increase in resilience is we all got put in this position of something we couldn't even imagine happening, and it really pushed us to be able to overcome some of these stressors and obstacles. And when we do push ourselves in those new ways, it can create a sense of accomplishment. It can create a sense of like growth through pushing ourselves to a level that we didn't think was possible before. So I have a feeling that's part of what was happening is part of this results. There's also another important bright spot in the survey results, and I think this is particularly relevant for us who are on this webinar right now. So the majority of respondents reported feeling supported by their faculty, their administration, their counseling center, and their student health center. So 69% of students reported that their campus administration had been supportive during the pandemic. And the highest number, actually 78%, perceived that their professors were supportive, which was the highest of all those groups. So higher than the counseling center, higher than the health center, higher than the administration. So we're seeing that students are recognizing and they're benefiting from that faculty support. However, it's important to note that the survey didn't break that down any further, so we don't know what aspects of support were actually most helpful for students, whether it was communication or flexibility, or what that was. So like I said, we're going to probably have more nuanced data the further we get into the fall. But the bottom line from all of this information, both anecdotal and from surveys, is that it's understandable, expected, and it's absolutely normal for our students to display increased signs of stress during this time. So for those who may not be as familiar with those signs of stress, those can include things like increased worry, fear, anxiety, or concern about their own health, wellness, and safety, or the health, wellness, and safety of loved ones, and changes in sleep patterns, changes in eating patterns, difficulty sleeping and concentrating, worsening of other health problems that we might have, and even increased substance use as a way to cope. So some of those signs of stress might even be things that we've noticed ourselves experiencing since March in this pandemic. I know there's a couple of those that have been relevant to my experience. So another chat question here. So I was wondering if we could share as a group any strategies that you found most effective in supporting students in your role as faculty or in your role as staff around this pandemic. So things that you have found effective in the spring semester and the summer semester. And I'll read those for us as a group so that way we can all benefit from some of these interventions that we've already come up with. So I'll take a moment for people to respond to this. Okay, I'm seeing being flexible with deadlines. Yeah, that seems very important. Kind of similar to that, I've heard that it's been appreciative for students to have webinar or have classes available on demand. So with the scheduling and work concerns and family responsibilities and obligations, it's been helpful for them to be able to watch those webinar or the classes in the evening or during their work breaks, and to have that flexibility versus trying to be available at one time at the same time each week. So we got quite a few more responses in here. Checking in with emails for advisees, so reaching out via email, reaching out via phone, keeping those lines of communication open are very important. Being transparent, I love this one. Being transparent and letting students know that we're also, as faculty and staff, learning technology that's being used right now, and that we're not experts, but we can kind of demonstrate our adaptability and our learning as role models and how to do that gracefully. We have hosting virtual office hours for students so that we can chat and they can process through what is happening in the world and how they are coping. So it sounds like, those office hours aren't just hitting on what's being presented in class, but also caring for the student as a whole person and the different environmental factors at play. I see weekly Zoom meetings for all staff together with mental health checks in the meetings for each person to express themselves. Yeah, so having a space to kind of process and share one's experience. I think that's helpful because there's so many folks who I think are, even at the faculty and staff level, who are more isolated right now and might be in need of more social support. And we might be the only avenue of social support as coworkers. Continue to check in, take time through email or at the start of class to ask reflective questions, engage in affect. How we feel has an impact on how we learn. Students should know that and avoid shame or blame around that. Being more flexible with work schedules for those who are supervisors of student employees, having remote work options for them as well. Continuing to have fun with the material and with our in-class interactions. I know that that's been probably a huge learning curve for all of us, is how to keep things fun and engaging when we're doing this remotely. Staying flexible. Yeah. Hosting different staff meetings and whatnot for folks to be able to interact with one another, doing weekly one-on-one meetings to check up. Flexible with scheduling meetings, asking them how they're doing and asking what they're doing to cope, encouraging self-care, and I think even reinforcing positive coping skills. So if we're hearing aspects of a student's experience that they're coping with their stressors really well and that it's working constructively and not damaging them in any way, highlight that and reinforce that. It sounds like that's really working for you. Wow. Versus if they're saying they're using alcohol or drugs or other forms of coping, we definitely don't want to encourage or support that type of coping. And the last one I'll read is themes for all staff meetings so that they can dress up, have something to look forward to, and have fun with. So example, hats, vacation spots, costumes. So being really creative, I love that idea, with how to make the use of technology more fun and engaging, and to give people maybe a sense of levity throughout this time. So thank you all who responded. We'll go ahead and move on. hopefully y'all I definitely got some new ideas from this. So hopefully hearing me read those has helped y'all come up with some new strategies as well you can implement. Okay, so this next one, next slide I entitled "It Takes a Village," and I think this is really important. So as we continue through this presentation, it's important to consider what role we have as faculty and staff, particularly those outside of the counseling center, have in supporting a culture of mental health and wellness on campus, particularly during the pandemic. So I've been working on college counseling centers for the past 10 years at 4 different universities now. And over those experiences, I've seen different and varying levels of comfort of working with students in different levels of distress and uncertainty on when to refer a student to the counseling center versus when to use one's own empathy, listening skills, and knowledge of campus resources to help in this situation. So hopefully through this slide and a couple more that I'm providing, that'll help connect you with some resources that help determine when can I be helpful and when do I need to refer. So faculty and staff are in a unique position of helping, as you typically have a baseline or an existing relationship with these students that you can utilize to connect them to resources and to support them. So oftentimes, I know this is true from many of the conversations I've had with folks like in advising, for example, is that students feel more comfortable opening up and talking about their personal concerns with an academic advisor or with a faculty member. So talking about their stress or their concerns rather than coming into the counseling center. And there's so many reasons why that's true. I think it is the relationship, but it's also things like stigma at play there. But it can be a really delicate process of boundary setting and establishing when you've reached the limits of your competency and even your available time. So knowing that there's some students who may need more support, more guidance, more check-ins than we have in our schedule, right? So those are all good indicators of when it's time to refer to the counseling center. It's also important to remember that mental health stigma exists, particularly in our minority students coming from rural backgrounds and areas, those who are male identified. Those factors have all been shown to impact students' their willingness and their comfort in reaching out for formal support. And I think that's another reason why these students reach out to faculty and staff versus coming into the counseling center. So of course, there are many times when we can help as faculty and staff with our listening skills, but there are many situations when it's beneficial to consult and refer students to us at the counseling center. So we'll discuss, for example, at-risk training here in a bit that's going to help with that. But these would be like such situations as like crisis situations involving suicide, homicide, psychotic symptoms. So like seeing things, hearing things, being really disorganized with one's thoughts, and sexual assaults, anxiety and depression with functioning being impacted or impaired, just to name a few situations. And when in doubt, you can always call us to consult and we can walk through like, okay, this sounds like definitely something that we'd like to see this person and check in versus, maybe that's when listening skills, maybe that's when a gentle referral can come in handy. But I do also want to highlight that there's numerous occasions when providing space to hear a student's concerns and validating their experiences or directing them to an on-campus resource can in and of itself be healing. So the examples I'm thinking of here are things we've all probably heard from students. So breakups, experiencing distress or tearfulness around failing an exam or not doing as well as they hoped they did. Or even imposter syndrome. I hear that a lot from our first-gen students and from our students of color. So just I want you to think about your own times when you've received support, guidance, or advice from a coworker, boss, or a mentor during these temporary stressors. And maybe this is a time when we as faculty and staff can step up and be that good listening ear for them to just kind of get through that temporary bump in the road. So when supporting students, we can also fall back on sharing some of our own personal experiences, navigating obstacles, as many of us were also college students back in the day. If we can, for some of us, it's been a little bit longer than others. So all these steps that I'm talking about, they can promote a culture of care and a culture of concern on our campus. So seeing students as more than just a name or an A number, and feeling personally invested in their growth, their success, and their well-being. So even informally asking how a student is doing can help create a comfort, a sense of safety for them, to where that they feel if they do hit one of those bump in the roads or something even bigger, that they can come to you for support or come to you to help connect them with a resource such as a counseling center. So I used to teach at the college level as well, and found that that was super important to just take a few minutes at the beginning of class to connect with students as an individual, maybe waiting for class to start, those who came early, just having chit chat conversations. And that really helped to open that door for, you know, them feeling comfortable reaching out if they did need care. Okay, so let's talk about some specific support strategies here that I think can be super helpful for us. So as we're working with students, particularly with the pandemic, I think it's important for us to remember that each student is coming from unique backgrounds and unique circumstances. So COVID-19 is impacting communities in different ways and can have differing impact on a student's routines, their schedules, their finances, their housing. The way one student handles stress and the way that it manifests for them may look different from another student. So that's such an individualized process. Some students may feel more comfortable and open communicating about their difficulties and stressors and the impacts that that's having on their academics, while some may not feel comfortable doing that. So although there are recommendations, as we know, for physical distancing with COVID-19, we need to be really mindful about encouraging students to maintain connection and engagement with their friends, with their peers, with their classmates, with their families, and with others through the use of technology or safe, socially distanced activities. The same is true for fostering that sense of belongingness as part of a university and part of a campus community. So we know that's super important for students to feel like they belong here on campus, and that's vital for their retention and for their success while they're here. So students who were already feeling isolated before the pandemic or feeling excluded, they may feel even more so excluded or isolated at this time. So I recommend that we really be intentional as a campus this fall when we're doing our programming and when we're in those roles, creating activities, that we are doing these both virtually and safely in person if those can be done. So this may look, even if we're not in that role of organizing, we can be promoting those through flyers in classes, through email, sharing announcements, promoting virtual study groups, virtual meetings with student employees so that they have times to connect. I feel like we are so caught up on creating an on-campus experience, but we need to look at Zoom and technology to develop spaces that are going to be inclusive and accessible for students who, let's say, they are at higher risk or do have some kind of risk factors that don't allow them to physically engage with their peers during this time. So we want to make sure that we're making these opportunities inclusive to all, especially those who are more vulnerable or who had to leave the campus area. So an example I wanted to share is that each semester we at the Counseling Center have been hosting a feed friending event where it's kind of like a friendship networking event, just giving students a casual space to be able to connect and make connections and friendships, because we know isolation and that loneliness is such a huge part of the student experience, unfortunately, right now. But we're looking at revamping that to more of an online framework and an online event so that folks can feel safe and comfortable using that as a tool. versus trying to do that online, when we'd be excluding a lot of folks by doing that. So I've heard this in our chat already, but trying to be flexible where opportunities allow. The students may have unpredictable and unplanned circumstances related to COVID-19. So things such as illness, work changes, technology problems, or even family responsibilities that may impact their academic performance. So, especially with daycares and childcare facilities being closed or not being accessible for everyone at this time, folks may be caring for young ones while also trying to study and watch their lectures or even working. So we need to evaluate ways in which we can be flexible with extensions, assignments, or program requirements to accommodate these types of situations on an as-needed basis. But just keep in mind also that students may have a harder time acquiring documentation during this time. So just knowing that, at least for myself, like it's taking a little bit longer to get into a doctor's appointment because of so many of the healthcare facilities being inundated with the testing requests. So they might have a harder time getting into a doctor, getting into a mental health provider, those kind of folks who have traditionally provided that documentation for faculty. So students, like many of us, are inundated with news around the pandemic, and this can increase higher stress levels and anxiety for us and for our students. So we as instructors, we as employers, we can acknowledge the pandemic without making it a constant topic for those who are trying to minimize their exposure to that news and to that topic. So avoidance and distraction can actually be a really valid and a really helpful form of coping for some people. So for example, we might want to be thoughtful of avoiding creating assignments focused on the topic, as that could be distressing for folks or triggering for folks who would then be required to focus and sit with that topic for extended periods of time. And given that we're all going through this together, there may be times where it's appropriate for you to share with your students ways in which you have found that you've been able to cope with stress or challenges related to the pandemic. So this may be particularly helpful for those who have one-on-one relationships with students. And there'll be, I'm sure, ample opportunities to model adaptability as we go through the fall semester and those different scenario-based teaching delivery methods. So we can model how to kind of roll with the punches in a way that teaches that skill to our students. So an example of like a coping skill that I feel comfortable sharing with y'all and that I share with my students is that I personally take days off from watching the news or reading the news about the pandemic. Because not a lot changes from the day to day, at least at this moment. And I know that if I watch the news every second or third day, I'm still going to get caught up with where things are right now. And I try to also set limits around media consumption, particularly around the pandemic before bedtime, just because I know that can be pretty activating and get my mind racing and thinking quite a bit about that, which isn't really conducive to me being able to sleep well. I also want to encourage us all to be familiar with support resources on campus, particularly anything new that rolls out related to the pandemic. So like we've talked about those, that different scholarship money that was coming out over the summer for students. If there's any new initiatives in that area, we really need to be mindful and aware of searching out those opportunities and then distributing that information. And there's also some really great existing resources that I feel like maybe fly under the radar sometimes that are particularly helpful right now. One example that I always love to share and to spread the word about is the Bobcat Bounty, which is the food pantry on campus, and how that could be really helpful for students who are experiencing job loss or food insecurity right now. And this next one's super important too. For those who are listening who are in a supervisory position, many faculty and staff are on the front lines of serving and supporting students, and they're leading the charge, so to speak, during this pandemic. So supporting them is one of the most effective ways we as leaders can support students. So it's important that we are attuned to the needs of faculty and staff as they play a vital role in shaping the student experience, since they're the ones who students have the most direct and frequent contact with. So I think usually faculty and staff are pretty good about compartmentalizing their stressors, but with the weight of pandemic and how that's touching every aspect of our life, we might want to consider adjusting expectations related to job productivity and evaluations, allow greater job flexibility when possible, consider the impacts on promotion and tenure, and also the basic needs of staff. Unfortunately, we know that there are members of our Texas State community who do have financial struggles and aren't getting paid enough to be able to afford their basic needs. So things like financial insecurity and food insecurity. And trying to really control the job stressors as much as possible, knowing that that's one area of control that we might have as employers. So there is also a lot of potential personal stressors on faculty and staff happening right now. So partners losing jobs, caring for vulnerable others, childcare issues or concerns, things like that, that may impact our performance. I think it's important, like this is the way I explain it, is that it can be, when our house is on fire, it can be really hard for us to take care of other people, so to speak. So we just need to look at what we have in our control or in our power to help faculty and staff be intellectually, emotionally, and physically available and present for our students as much as possible, because I feel like that's gonna benefit the student experience. So now I'm going to be discussing some digital resources for yourself and for students, which may be particularly helpful, and things that you can share with those who are not going to be in San Marcos or Round Rock, or those who are social isolating and distancing and don't feel comfortable coming to campus or into an office. So I've been talking a lot about building a culture of care and support, which can involve us having discussions with students about mental health. At-risk can help in these situations because it's free, it's specifically tailored for faculty and staff and student audiences, and it only takes about 45 minutes to complete. It can be repeated, so like let's say it's been a few years since you've done it. I really recommend you go through and do a refresher just to have our brains kind of primed for these conversations when fall rolls around. And at-risk can really help us better identify the warning signs in our students who are struggling, and to build the confidence in talking with them about those concerns and expressing that concerns about them. And this contains some realistic scenarios. And the cool thing is it allows you to choose different types of responses to see which one jives most with your personal communication style. And it shows the impact of those choices on the situation. I also find this helpful a tool that's helpful to promote if you're working with student leaders as well, and different connected students on campus, as it can help them recognize signs of distress in their peers. Because if we think about it, sometimes students are more receptive and to help and resources from each other and from their peers than they are from us as older folks. Okay, I want to, earlier I was referencing that it's hard to help others when our own house is on fire. And I was speaking with colleagues from another department this week, and they brought up that we typically hear about Texas State's Bobcat Balance and the employee EAP program during our new employee orientation, and that we tend to forget to exist when we actually need it. So I wanted to take a moment to remind us all about that program. And with Bobcat Balance and their EAP, you're actually entitled to up to 5 free sessions per mental health problem per year. And I didn't know this until I started researching it more for this webinar, but some graduate student employees in benefit eligible positions are actually eligible to use this program as well. So something good to keep in mind if you work with some of our GAs. So the type of concerns that they work with are things like parent and family relationship concerns, stress, depression, substance abuse, workplace conflicts and drama, all that kind of stuff. So they also, when you call, they can provide you a list of providers near your zip code. And many individuals in private practice are actually still doing telehealth sessions. So that may be an option for you as well if you don't feel comfortable actually going into a provider's office. So another important employee resource I wanted to just share with y'all, because this was a change, is the mental health coverage provided through our insurance. So Blue Cross Blue Shield Health Select the mental health portions was previously being managed and serviced and carved out through Magellan, but now will be managed in-house through Blue Cross Blue Shield in September, which if anyone has tried to utilize those resources, let's hope that this is a huge improvement because there were quite a few issues with having a small pool of providers for that Magellan network, and that impacted continuity of care. So they would see someone with this Magellan coverage and then find out how much they were actually being reimbursed, and were saying, you know, I can't continue to provide this care. And so I'm part of a lot of like networking groups for providers in Austin, and just saw that it's very, very, very hard to find a therapist who's taking Magellan. So let's just keep our fingers crossed that hopefully this change that's happening in September will create a wider network of providers for us to use through our insurance. So the next resource I'm going to talk about is therapy assistance online. So many faculty and staff are actually not aware that in addition to being a great resource for students, it's also something that we as faculty and staff are eligible to use. So TAO, it's interactive, it's dynamic, and it's easy to use, and it's an online program. It provides support modules for anxiety, depression, and other common concerns. The great part of this is that it's, you know, accessible 24/7 and that you can do it from home. There's actually a new version that's going to be rolling out here next month, version 3.0. So I personally find this super helpful to share with students who seem hesitant in coming into the counseling center. They're uncertain whether they want to start to address some of their issues or concerns. You know, their concerns are low risk. And also for those who have fear or stigma around coming into the counseling center or assessing resources in person. It's also really helpful for students who are like student leaders on campus, and they say, you know, I'm too busy to come into the counseling center, or, you know, I have to wait too long. You know, provide this resource for them and, as something that can be helpful. And for now, this is the link. I have the link on the page to access it, but that may be potentially changing with the new version in August. So if you go to our website and go to Therapy Assistance Online, that's a way that you're going to be exposed to the most accurate link to access that program. We're going to skip the video for time. So there's some additional resources I wanted to make sure everyone's aware of. So human resources or professional development, they provide a course that's conducted or led by one of the psychologists here from the counseling center. And that's called Mental Health Concerns at Texas State University, Trends, Resources, and Interventions. So that workshop, it teaches you how to identify factors contributing to the changing student mental health trend, recognize and respond to students who are suffering from mental health problems, and refer them for help. So that's offered typically every fall and every spring. So I just encourage you to keep an eye out for that and register when that comes open. They also offer mental health first aid trainings, which can be helpful for suicide prevention and helping support students with mental health concerns. There's also the Texas State Minds Matter resource. So this is a really comprehensive kind of like one-stop shop website that goes over all the different mental health and wellness resources across campus. And it also has a free FAQ, or frequently asked questions section, specifically geared towards faculty and staff. So definitely something I would bookmark. So when you're in these situations with students or you get an email, you can kind of reference this page to help determine where to go and what to do. So we also on our website provide a lot of resources. We have a tab for assisting faculty and staff with student mental health concerns, and our website's being continuously updated with any kind of service changes that in terms of the types of therapy and the delivery of that therapy in response to the pandemic. Also want to highlight the pause alert system. So the pause alert system is an early intervention website that allows faculty and staff to refer students who are experiencing academic, personal, or transitional issues and difficulties. And so those include stress, poor attendance, poor academic performance, failure to submit assignments, mental health concerns, financial problems, etc. So the person in the chat who said there's been some people fall off the radar and you haven't heard back from them, the pause alert system might be something to consider in this situation. So that way we as a university can respond and reach out to that student and get them connected with any resources that they might need. Okay, and we're almost done, just another minute or two here. The way you and faculty and staff utilize the Counseling Center as a referral resource may look a little bit different for students who are not physically on campus this fall or who are located all across the state of Texas. The Counseling Center, we do provide consultations through our staff that are available via phone and in person for faculty and staff who are concerned about a student. And we can help you come up with a response plan or a game plan for how to respond and how to best act in those situations. So it's really important. I want to stress that in urgent situations, so if like someone's talking about, attempting suicide, please don't send those requests to the Counseling Center inbox, especially after hours, since that inbox isn't monitored in the evenings. That's definitely more of a concern that you want to reach out via phone or call UPD. And we do have a crisis hotline of things like that, or 911 even. So we've had that situation before where some urgent concerns have come through the email, and we definitely want to not do that so we can make sure we're responding in a timely manner. So we'll also be providing telehealth mental health services as an option this fall, which will allow for greater access to our services for students not in the campus area. So students who are interested in starting services, they just call our office at our main number, which is 512-245-2208. And we can discuss with them the most appropriate service options and whether that be in person or through telemental health. Staff will also be available at the main campus to help with urgent services as needed. And we'll also be offering our group programming online, which may be particularly relevant for students right now who are feeling isolated or needing to connect with other students who are having similar concerns. So that's definitely a safe way for them to get support and to also be able to connect with other students. And that group schedule will be released when we get closer to the first day of classes. So students will continue to have access to our 24-hour crisis hotline, 1-877-466-0660. And our Counseling Center has self-help resources on the website. In particular, we have a really comprehensive COVID-19 resources page, which talks about all types of mental health resources and coping skills for dealing with the pandemic. In addition, we do have a new page out around racial trauma resources. We have mental health recorded presentations like this webinar. We have videos, we have podcasts, and we also have lists of recommended phone apps. And I wouldn't be doing my job if I didn't talk about outreach. So this fall, we're working to develop something similar to what we did in the summer. This summer, where we're going to be doing different workshop or webinar series to make sure that we're reaching students and sharing pertinent information. But also we do QPR trainings. A lot of folks don't know this, but if you want to get together as a department or as an office and request this training, QPR is question, persuade, and refer, and it's actually a suicide prevention training. So we have a couple of members of our staff who are certified facilitators of that, and so they can come in and provide that training for y'all. And to do that, if you go to our website, there's an outreach request form. So you can use that, or you can just email the Counseling Center and I'll help you get that set up. Okay, so I'm actually over my time and I have another appointment to get to that I was supposed to get to at 3. So I'm going to kind of skip the question portion here. But if you do have any questions that come up, please give us a call at 512-245-2208. Our website URL is here. We are active on social media. So we're on Facebook, we're on Twitter, and we're also on Instagram. And if you missed any part of this presentation, if you go to our website under the recorded presentations section on our self-help part, this webinar will be up in about a week or 2. So if you didn't get all the links and that kind of stuff, this will definitely be posted online for you to access as well. So lots of information. Thank you all for being present today. And I look forward to hopefully seeing you all either virtually or in person this fall. So I just wanted to give you all a virtual pat on the back for being here today and just showing your dedication and support for our students. So we're all going to get through this together, and we're all going to do this as a community and as a Texas State family. So thank you all for attending, and I hope you all